You can do this one move sitting at your desk. No one will notice. It takes just 3 seconds. And it could be the difference between a weak, disappointing erection and one that brings your confidence back. Most doctors won't tell you this, but urologists have known it for years. It's simple, powerful, and 100% natural. If your erections have been getting weaker after 60, it's not just aging. And the fix is easier than you think. Here's what most men don't realize. By age 60, over 60% of us experience some degree of erectile weakness. But here's the scary part. It's not just about sex. Weaker blood flow down there can be a warning sign. It often shows up before symptoms of heart disease. It may also signal early-stage prostate trouble. And without healthy blood flow, oxygen drops. That leads to faster tissue aging. Not just in the penis, but sometimes throughout the body. It can fuel fatigue, low self-esteem, and in some cases even depression. The worst part? Most men assume it's just age. They give up. They stop trying. But the truth is your body is more adaptable than you think, even after 60. So here's the question. What if you could train one hidden muscle group without going to the gym and improve your blood flow in just a few weeks? What if it only took 3 seconds? This isn't some new age remedy or overhyped supplement. It's backed by clinical studies, used by urologists, and often prescribed to men recovering from prostate surgery to restore performance fast. And right now, as you watch this video, you can start doing it. Let's start with a misconception. Most men think strong erections are all about testosterone and arousal. Yes, hormones matter. So does your brain. But there's something else most guys overlook. At the base of your penis are small but powerful muscles. And when these weaken with age, something subtle but serious happens. Your blood doesn't stay locked in during an erection. Instead, it leaks out faster. That means your firmness doesn't last. Sometimes you get a partial erection. Sometimes it fades quickly. We rarely think about it. But these muscles are vital. They act like a clamp. They trap blood in the right place. And when they're weak, that clamp fails. But studies show this is something you can improve. The International Journal of Impedance Research published findings showing that strengthening these pelvic muscles can support better erections without any pills or drugs. Even men in their late 60s saw results. So what's the solution? It's something so simple, so fast, that you may not believe it works until you feel it. It's called a kegel squeeze. You've probably heard of kegels for women, but fewer people realize they're just as critical for men. Think of it like this. The pelvic floor is a hammock of muscle that supports your bowels, bladder, and yes, your sexual organs. Within that group are 2 important muscles, the bulbocavernosus and the ischiocavernosus. You don't need to remember those names. Just know this, they do 2 important jobs. They help you stop the flow of urine when you need to, and they help trap blood during an erection. By learning how to contract these muscles and doing simple 3-second holds, you can start rebuilding what time has taken away. This contraction is subtle. You're not moving your legs, your abs, or your backside. You're simply squeezing the muscles that cut off urine in mid-flow. Not forcing it, just engaging them. Each contraction takes about 3 seconds. Do it 10-12 times once or twice a day. So, 30 seconds here, maybe a minute there. That's it. And over time, just like doing curls for your arms or planks for your core, these muscles get stronger. You may start to notice firmer erections, more control, and perhaps the biggest benefit, confidence. Now, why does this matter, especially if you're over 60? Because those same pelvic muscles have probably been on vacation. Long hours of sitting weaken them. Aging slows muscle signals from the brain. Medications like blood pressure pills may affect the area. And especially common among older men, there's often mild nerve slowing near the prostate. This all adds up. Blood can't hold its ground. But the good news? These muscles respond when you give them attention. And this technique has actually become one of the first things urologists recommend to men recovering from prostate surgery. It helps support everything from urinary control to sexual function. A study from the British Journal of General Practice showed that men with average to poor erection quality who began consistent pelvic floor training showed big improvements after just 12 weeks. Some didn't even need medication after that. These weren't college athletes. These were men in their 60s and 70s. And for them, it wasn't about getting superhuman results. It was about getting back what they thought was gone for good. It's not hype, it's science. And now you know the muscles that matter most. Take Steve, for example. He's 68. He started doing a simple version of this 3-second squeeze watching the news each night. At first, nothing noticeable. But about 10 days in, he started waking up with a firmer feeling. By 4 weeks, he told his doctor he felt 20 years younger. Another guy, Mike, a retired truck driver. He had written intimacy off completely. Too embarrassed. Too tired. Then a physiotherapist quietly suggested pelvic training. He laughed at first, but started the routine. A few weeks later, let's just say he wasn't laughing anymore. These transformations don't happen overnight, and there's no magic bullet. But when you know which part of your body to train and how change gets easier, and even if your testosterone is normal, if you're not locking blood in properly, firmness will always be a challenge. But now the equation becomes simple. Stronger muscles equals stronger erections. And not the kind of muscle you lift in the gym, the kind no one sees. And now you know where to start. In part 2, I'll explain exactly how to perform the 3-second move and how to make sure you're doing it right every time. Plus, you'll hear the full story of a 72-year-old man who got his full performance back without pills, surgery, or embarrassment. But first, before you go anywhere, try this, right now. Sitting wherever you are. Just gently contract the same muscles you'd use to stop yourself from peeing. That's all. Feel it? That's a start. And we'll take it from there. Good. Now that you've found that muscle, let's make sure you're using it the right way. Because here's what trips guys up. They squeeze too hard. Or they involve muscles that don't help, like their abs, their thighs, or even their butt. That actually works against the process. So slow it down. Make the movement clean and focused. Think about gently lifting the muscle that would stop you in midstream, like a light switch on and off. Hold it for 3 seconds, then fully relax. That relaxation is just as important as the squeeze. A lot of guys tense up and forget to let go, but you don't want to turn tension into a habit. You want controlled strength. That's what improves function. Now, how do you know you're doing it correctly? Here's a simple way to test it the next time you go to the bathroom. Halfway through peeing, try to stop or slow the stream. That muscle you used to do it? That's the one you're training. You don't want to do your full practice while urinating. Just test once to check the feeling. Once it's familiar, you can do these squeezes anytime. Waiting at a stoplight, sitting at your desk, watching TV. No one will notice. You don't need equipment. You don't need a doctor's visit. All you need is consistency. We recommend 10 to 15 squeezes. Once in the morning, once at night. You can build up to a 5-second hold as the muscle gets stronger. But start with 3 seconds. Breathe normally. Don't hold your breath. Don't clench your stomach. Keep your focus down low, where the base of the penis and the pelvic floor meet. Some men like to place a hand on their belly to make sure those muscles stay soft. That helps. Over a few weeks, you'll begin noticing more control. You might start waking up with firmer morning wood again, or find that during intimacy, erections last longer. One man wrote in saying he hadn't had a full erection in years. He was 72, widowed, and honestly thought those days were over. But on a visit to a physical therapist for back pain, she happened to mention pelvic floor training. He figured there was nothing to lose. So he started slow. Every morning during coffee, he did 10 squeezes. Then again each night, brushing his teeth. After about 6 weeks, something surprising happened. He felt aroused again, not because of a pill or a fantasy, just naturally. He said the hardest part wasn't the exercise. It was believing his body still had that ability. That's what this kind of training can unlock, not just physical strength, but emotional confidence. And here's a fascinating part. Studies suggest these muscles don't just support erections. They may influence urination, digestion, and even posture, because the pelvic floor is part of your core. And when it's weak, everything shifts downward. Some men notice lower back pain, or more bathroom urgency at night. So by restoring those inner muscles, not only do you improve blood flow, but you support broader health too. Now, some guys ask how long until I feel a difference? For most men, small signs start showing in 2 to 4 weeks. Better sensation, more volume, easier control. And again, this isn't a miracle overnight transformation, but it is progress, the kind you build over time and multiply. Because here's where it gets exciting. Once you master this basic 3-second squeeze, you can layer it into small habits. Try a few just before intimacy, or combine it with a short walk. Some urologists suggest squeezing and walking at the same time to increase blood supply. It's like waking the area up before you even need it. Little things, big difference. And if you want to take it even further, there are now physical therapists who specialize in men's pelvic health. A few sessions can help refine the technique even more. But many men never need that. Just this one move, done daily. Now, let's go back to where we started. You're sitting in your car, or on your couch, or at your desk, and a weak erection has been making you feel less like yourself. But now you know why it happens. You know which muscles to target. And you have the exact move to make things better starting today. 3 seconds, twice a day. That's all. And gradually, you reclaim control over something most men assume is lost. But here's the choice. You can keep hoping things get better on their own. Or you can invest 60 seconds a day to start rebuilding hidden strength from the inside out. What'll it be? In our next video, we'll cover a simple upgrade to this technique that helps support prostate health at the same time. It's something elite men's clinics now recommend to combine sexual performance with urinary support in one easy step. You won't want to miss it. But for now, make today the day you begin. If this video helped you, drop a comment below to let us know. Or better yet, share it privately with a friend who might need it. This one small move may be the beginning of your comeback. And we'll be here every step of the way.